Hello learners, welcome to the yet another session of MEV 002. Today we are going to discuss about chemical hazards faced by healthcare workers. Before going into the details of this session, we have to see that what we have learnt in the previous session. So to recapitulate the previous session, in the previous session we have learnt about healthcare workers, those who are directly involved or indirectly involved with the provision of health services to the individuals. These services can occur in a variety of work settings like hospitals, clinics or otherwise dental offices, outpatient surgery centers and birthing centers, emergency medical care and home health care and also nursing homes. So, healthcare workers normally face a number of seriously and safety and health hazards. Maybe it is a bloodborne pathogens they may directly contact with, and also sometimes it may be a biological hazards or potential chemical and drug exposures, or sometimes it may be a waste anesthetic gas exposures and respiratory hazards, ergonomic hazards from lifting and repetitive tasks, or laser hazards, workplace violences, and also sometimes they are associated with laboratories and radioactive materials and X-ray hazards. So some of the potential chemical exposures like formaldehyde, which is used for the preservation of specimens for the pathology, and also ethylene oxide, glutaraldehyde and peracetic acid, these type of chemicals they are used for the sterilization purpose. So and also this varieties of other chemicals are also used in the healthcare laboratories. So many chemicals which are used in the hospitals are capable of producing adverse health effects through either maybe it is a inhalation or by absorption through the skin whenever we will touch that sort of platforms, or sometimes they act on the hematopoietic system and damage the lungs, skin, eyes or mucous membranes. Chemical hazards in the workplace for healthcare workers, especially today we are going to discuss that. That may be the exposure to the anesthetic gases or antimicrobial drugs, or sometimes it may be anti-neoplastic agents, disinfectant agents like ethylene oxides, formaldehydes, glutaraldehydes and latex and other solvents. And the workers, those who are at operating room, delivery area, recovery units, they have potential exposure to anesthetic gases every day. So that have known adverse effects on the reproductive system. Regular maintenance and inspection of the anesthesia or the delivery equipment and also use of scavenging systems and the maintenance of room ventilation rate and also the provision of training to staff members, that could be definitely effective in reduction of exposures. And also not only these nurses are the doctors, in pharmacists, oncology nurses, housekeepers, everyone are at the high risk of exposure to hazardous drugs which are prone to health effects on the reproductive system and also sometimes pregnancy outcomes. So implementing vertical flow biological safety cabinets and also personal protective equipments are capable in controlling hazardous effects. And disinfectants like formaldehyde and glutaraldehyde, they are highly associated with the irritants and also allergic effects on skin and respiratory system, like and also sometimes it may induce asthma. So some of the chemicals which are used in the hospitals are mostly disinfecting and sterilizing agents, and sometimes it may be a medical gases, anesthetic agents, laboratory chemicals or otherwise cytotoxic drugs and also pharmaceutical substances. So we have seen in the previous session that how chemicals enter into our body through any of the routes like inhalation, or sometimes it may be that is a breathing in the chemical like anesthetic gases, or another route is ingestion. That means via contaminated food or contaminated hands, it is non-clean hands, and also the other one is the inoculation. So when a sharp object like a needle punctures the skin, and also finally through that absorption through the skin contact or a splash in the eye. So these are some of the different routes of inhaling or going inside our body the drugs. Some of the chemicals that are used in regular basis in the hospitals to treat patients, that may be a beta propiolactone sterilant of blood plasma, water, milk, and also nutrient broth. And as a vapor phase disinfectant, it is in enclosed spaces, which is highly carcinogenic in nature. And also hexachlorophene, which is used as a disinfectant in neurotoxic in nature. If we will consider the sodium orthophenylphenate and also glycols, they are used as a disinfectant, and there is a lot of evidence that it causes the bladder cancer. And another example I would like to give is benzol, that is used as a drug and also disinfectant that causes leukemia and also sometimes chromosomic aberrations. And another example, that is a formaldehyde, that is used as a disinfectant but also causes skin and respiratory tract irritation. Glutaraldehyde, which is a famous sterilizing agent. And respiratory and skin sensitization, severe irritation of eyes, skin and respiratory tracts it can create. Ethylene oxide, it is also widely used as a sterilizing medical equipment, but it causes irritation, cataract, as well as the cutaneous lesions and conjunctivitis and corneal burns. Some anesthetic gases like isoflurane, diethyl ether, chloroform, nitrous oxide, halothane and trichloroethylene, these are used in anesthesia that causes alterations of perception. Sometimes if pregnant ladies are there, abortion and birth defects may occur. And also these defects continues to the cognition and motor skills and hepatic and kidney diseases and also malignancies. So many hazardous chemicals which are present in healthcare settings that definitely pose an exposure risk for the healthcare workers, patients and also those who are surrounded by them. So these chemicals are used to treat patients like anticoplastic drugs, and also sometimes it aerosolized medications and anesthetic gases. Clean, disinfectant and sterilized work surfaces like phenolics, quaternary ammonium compounds or bleach, and also sometimes medical supplies and instruments like ethylene oxide, glutaraldehyde, and also as a fixative for the tissue specimens like xylene, toluene and then formaldehyde. These are some of the chemicals every day they are encountering in the hospital sector. And surgical smoke, that is generated by the lasers and also electrosurgical devices during the surgical procedures, that contains many chemical substances in addition to the viruses and bacteria. Even though it is very strange to the common man, but every day they are encountering. So the control of chemical hazards in hospitals must be based on classic principles of good occupational health practices, because healthcare facilities are normally accustomed to the approaching health through the medical model that focuses on the individual patient and also treatment rather than on prevention. A special effort is required to ensure that the orientation for handling chemicals is highly required and preventive, and also that measures which are principally focused on the workplace rather than the worker. Another important aspect is the environmental, or otherwise we can say that engineering control measures. They are the key aspect or the key criteria to prevention as well as the deleterious exposure of that certain chemicals which are from the equipment. However, it is necessary to train each worker correctly in appropriate exposure prevention techniques. In fact, right to know legislation as such it is given by the government that requires that workers should be informed of the hazards with which they work as well as the appropriate safety precautions before going into the sector. And secondary prevention at the level of the worker is the domain of medical services, that may be medical monitoring to ascertain whether the health effects of exposure can be medically detected or not. And it is also consists of prompt and appropriate medical intervention in the event of the accidental exposures. So these are not normally happens. So chemicals that are less toxic in nature must replace more toxic ones. The processes should be enclosed wherever possible, and also good ventilation is essential. While all means to prevent or minimize exposures should be implemented. If exposure does occur, like a chemical is spilled for example, the procedure must be in place to ensure prompt and also appropriate response to prevent further exposure. Applying the general principles of chemical hazard control in the hospital environment is most important. So what these principles says about it? In the very first step in hazard control is hazard identification. After that, it requires a knowledge of physical properties, chemical constituents and toxicological properties of chemicals in question. Material safety data sheets, what we have already learnt in the previous sessions, MSDs, which are becoming increasingly available by the legal requirement in many countries. They have to enlist the properties of that particular chemicals. The vigilant occupational health practitioner, however, should recognize that the MSDs may be incomplete sometimes, and also particularly with respect to long-term effects or the effects of the low-dose chronic exposure. So, a literature search may be contemplated to supplement the MSDs material. And also, wherever there is an appropriate measures have to be taken, these things will come up. In the second step in controlling a hazard is characterizing the risk. First one is assessing and the second one is the characterizing. So here, does the chemical pose a carcinogenic risk or not? Whether it is an allergen or not, or it is a teratogen or not. So is it mainly short-term irritancy effects that are of concern? So to answer these questions, they will definitely influence the way in which exposure is assessed. And the third part is a chemical hazard control is to assess the actual exposure. So discussions with the healthcare workers who use the product in question is the most important element in this setup. So monitoring methods which are necessary in some situations to ascertain that exposure controls are functioning properly. So sometimes these may be the area of sampling, or either a grab sample are integrated depending upon the nature of the exposure. So it may be a personal sampling. In some cases it is a medical monitoring that may be contemplated, but usually as a last resort and only as backup to other means of exposure assessment. Once the properties of the chemicals that pose the hazards, the product in question are known, and also the nature and the extent of exposure which are assessed. So a determination could be made as to the degree of risk. So now this procedure is generally requires that at least some dose response information that should be available. Next step, that is first 3 steps. After completion of these 3 steps, after evaluating the risk, the next series of steps in that is to control the exposure so as to eliminate or sometimes to least minimize the risk. So in that case, the first and foremost that involves applying the general principles of exposure control. Organizing a chemical control program in hospitals is highly required. The traditional obstacles and also the implementation of adequate occupational health programs in healthcare facilities that have to be lagged behind the recognition of the hazards. So to minimize these things, training programs are highly required. And also the labor relations which are increasingly forcing hospital management to look at all aspects of their benefits and also the services to the employees, as hospitals are no longer tactly exempt by the custom or the privilege. And also legislative changes which are now compelling hospitals in many jurisdictions to implement control programs. So even though they are giving the treatment to the patients, they have to follow this type of rules and regulations. But obstacles remain. The preoccupation of the hospitals with patient care, that emphasizing treatment rather than the prevention, and the staff's ready access to the informal corridor consultation that have hindered the rapid implementation of control programs. The fact that the laboratory chemicals, pharmacists and a host of medical scientists with considerable toxicological expertise they have and are heavily represented in management has in general not served to hasten the development of the programs. The question may be definitely asked, why do we need an occupational hygienist when we have all these toxicological experts? To the extent that changes in procedure that threatens to have an impact on the task and services that has been provided by these highly skilled personnel, the situation may be made worse. We cannot eliminate the use of substances X or whatever it is Y, as it is the best bactericide around. Or if we follow the procedure that we are recommending, patient's care will suffer. Moreover, we don't need training attitude is commonplace among the healthcare professionals that hinders the implementation of essential components of chemical hazard control. Even though we know we have to be trained in particular chemical hazard mitigation procedures. Internationally, the climate of cost constraint in healthcare is clearly also an obstacle. To surprise, another problem of particular concern in hospitals is preserving the confidentiality of the personal information about healthcare workers. This is most important one. While occupational health professionals, they should need only to indicate that Miss X or otherwise cannot work with chemical Z, and also needs to be transferred curious clinicians which are often more prone to push for the clinical explanation than their non-healthcare counterparts. For example, Miss X may have liver disease, for example, and the substance is a liver toxin. Just imagine, so she or he may be allergic to that particular chemical, or she may be pregnant and the substance has potentially teratogenic properties. While the need to alter the work assignment of particular individuals should not be routine. So the confidentiality of these medical details should be protected if it is necessary. And another important aspect is right to know legislation. Many jurisdictions around the world have implemented right to know legislations. In Canada, for example, WHMIS, one organization, has revolutionized the handling of chemicals in industry. So the country-wide system has three components. First one is the labeling of all hazardous substances with standardized labels that indicating the nature of the hazard. And the second point is the provision of MSDs with the constituents of hazards and control measures for each substance. And the third one is the training of workers to understand the labels and the MSDs and to use the product safely. So, under this type of system in Canada and also OSHA's hazard communication requirements in the United States also, the hospitals have been required to construct inventories of all chemicals on premises so that those that are controlled substances can be identified and addressed according to the legislation properly. And also, in the process of complying with the training requirements of these regulations, hospitals have had to engage occupational health professionals with appropriate expertise and the spin-off benefits, particularly when there is a train the other trainer. And these are the programs were conducted, and they have included a new spirit to work cooperatively to address other health and safety concerns. And the corporate commitment and the role of joint health and safety committees are most important element in the success of any occupational and safety program. That is a corporate commitment that definitely ensures its successful implementation. Next, we have to understand that policies and procedures that regarding the safe handling of chemicals in hospitals have to be written properly and discussed at all levels within the organization, and also adopted and enforced as corporate policy. This is most important. That means we are not supposed to hide any of that information, those who are particularly exposure to these hazardous chemicals. And also the chemical hazard control in hospitals, that should be addressed by the general as well as the specific policies. For example, there should be a policy on responsibility for the implementation of right to know legislation that clearly outlines each party's obligations and also the procedures which will be followed by the individuals at each level of the organization. For example, who chooses the trainers? That is also most important, even though they are very small steps, and then how much work time is allowed for the preparation and provision of training, and also to whom should communication regarding non-attendance may be communicated, and like this. So there should be a generic spill cleanup policy and also indicating the responsibility of the worker and the department where the spills can be occurred. The indications and also the protocols for notifying the emergency response by the team, and also like the appropriate in-hospital and external authorities and experts, and follow-up provisions for exposed workers like this. So these are the so many steps which are involved to mitigate. And also specific policies should also exist regarding the handling of the chemicals, and the storage and disposal of the specific classes of toxic chemicals are more important. Not only it is essential that management be strongly committed to these programs, the workforce through its representatives must also be actively involved in the development and implementation of policies and procedures. Some jurisdictions have legislatively mandated joint, for example, labor management. So they joint health and safety committees that meet at minimum prescribed intervals, like bi-monthly in the case of some hospitals, regular hospitals that have written operating procedures and also keep detailed minutes, whatever we have discussed, and then what are the points we have noted it down. Indeed, in recognizing and importance of these committees, the compensation board is also there that provides a rebate on the premium paid by the employees based on the successful function of these committees. That means we have to provide some incentives also. To be effective, the members must be appropriately chosen. Specifically, they must be elected by their peers and knowledgeable about the legislation, and also have appropriate education and training, and be allotted sufficient time to conduct not only incident investigations but also regular inspections. With respect to the chemical control, the joint committee has both a proactive and also reactive role, that assisting in setting priorities and also developing preventive policies, as well as serving as a sounding board for workers who are not satisfied that all appropriate controls are being implemented. Here, the multidisciplinary team is highly required. So, the control of chemical hazards in hospitals, that requires a multidisciplinary endeavor. At a minimum, it requires occupational hygiene expertise. Generally, hospitals have maintenance departments that have within them the engineering and also the physical plant expertise to assist a hygienist in determining whether the workplace alterations are necessary or not. Here, occupational health nurses are also play a prominent role in evaluating the nature of concerns and also complaints, and in assisting an operational physician in ascertaining whether clinical intervention is warranted or not. In hospitals especially, it is also important to recognize that various healthcare professionals, those who have expertise that is quite relevant to the control of chemical hazards. So that means it is a specified subject area. So it would also be unthinkable to develop policies and procedures for the control of laboratory chemicals without the involvement of lab chemists or lab technicians, for example, or for procedures for handling anti-neoplastic drugs without the involvement of the oncologist or the pharmacology staff, because their expertise is essential for that purpose. While it is wise for occupational health professionals in all industries especially to consult with the line staff prior to implementing control measures, it would be an unforgivable error to fail to do so in healthcare settings. And another important aspect is the data collection. As in all industries and with all hazards, data which is needed to be compiled both to help in priority settings and also in evaluating the success of the program. With respect to data collection on chemical hazards in hospitals, minimally, data should be required to be kept regarding accidental exposures and spills so that these areas can receive special attention to prevent recurrences. At least we can mitigate that one. And the nature of concerns and complaints should be recorded. Normally unusual odors if anyone observes, and also the clinical cases which are required to be tabulated, so that for example an increase in dermatitis from a given area or occupational group could be identified. And another approach, that is a cradle to grave approach. It is highly increasing nowadays. The hospitals are becoming cognizant of their obligation to protect the environment. Not only the workplace hazardous properties, but the environmental properties of chemicals which are being taken into the consideration. Moreover, it is no longer acceptable to pour hazardous chemicals down the drain or release noxious fumes into the air. It is a very big crime. A chemical control program in hospitals must therefore be capable of tracking chemicals from their purchase and also acquisition, or in some cases the synthesis on site through the work handling or safe storage, and also finally to their ultimate disposal. Dear learner, with this I would like to conclude that it is now recognized that there are thousands of potentially very toxic chemicals in the work environment of healthcare facilities, especially in hospitals, pharmacists, and then nurses and nursing homes. All occupational groups may be exposed, and the nature of the exposures are varied and then very complex in nature. With a systematic and comprehensive approach, with strong corporate commitment and a fully informed and involved workforce, chemical hazards can be managed and the risks associated with these chemicals can be controlled. Dear learner, I hope you will be benefited with this session. In the next session, we will come up with some other important aspects of the environmental and occupational hazards. Thank you.